everybody, it's me, Marion, Miss Foot Fixer, in the Harley Medical Foot and Nail Clinic. So we have some verrucas here which I have divided. So we zoom in, what we can see is irregular striations. This one's quite small and this one's just bleeding a little bit there. So we're just going to divide it. Try to get rid of the first layer of the tissue. We've done quite a few treatments on this and it's not budging, so hence why we're going to do needling. Needling can be very, very messy, so make sure you have loads of gauze. Here's my gauze kind of packet. Do the verruca cells, what you can see, but also on the outside. And you want to also like dab around it just so you can see what is going on with that. How does it feel?
Nothing.
Yeah. Local anesthetic is wonderful, isn't it?
It's amazing.
Yeah. So we just want it really, really macerated. Really push that tissue into the subcutaneous deeper layer of the skin. We've done quite a bit of needling right now. You can see the tissue is quite macerated and it doesn't bleed that much. And we've done just a little bit more outside the area. So I think that's good. You know, I've been doing this for probably 10 minutes. So we'll just let that rest. We'll put something over because I need to do the bottom one now. So, yeah, good?
Yeah, nothing.
Again, it's just really needling. You put the tissue on the bottom because it does bleed, just to hold the bleeding.
Has this been a traditional treatment for verruca?
It's been, I think in the early 60s, I think somebody wrote a paper on it, and then now it's being more and more traditional. It's more advanced. This needling is more advanced kind of treatment. Debridement, silver nitrate, over-the-counter treatments. They're kind of like more conservative treatment, but needling. Remember, needling is one step before surgery, right? So it's advanced, but it's been out there for a while. And the reason why it's one step before surgery is that the incisions and the wound is not as big and it heals faster because ultimately you do have intact tissue, more intact tissue than a surgical wound. So, again, we've been studying this for a while. You can see the tissue is very macerated. Yeah. Kind of like honeycomb. What does it remind you of, Sahar?
Like Haribo's chewed in your mouth.
Delicious! Now
Haribos.
nobody's gonna eat Haribo anymore. I'm happy with that. And the point of it is to push the tissue into the subcutaneous tissue, to cause skin destruction, and then see how it heals. Have these verruca, you can see the bleeding has stopped already. Okay, it's fantastic. So we're just gonna put in I like to put in a Denon because ultimately there's a wound, and these can get infected. So I just like to have some antiseptic on it. So we're gonna do Inadine, and then we're gonna do Repol, which is a sterilized tape, plaster, and then we're gonna put some semi-compressed felt just to offload those areas, and then it's taping it up, and then we'll work on the other verruca that's really tiny. Well, it looks like it's dry skin, but we'll do that one too. No, thank you. Thank you, Repol. Yeah, semi-compressed felt and scissors, please. Semi-compressed felt here, so feeling where the lesion is. Just one on the front. And then a new sterilized gloves. We'll do the next one. Ask for consent for the tiny one too. So it'll be a separate video. So this is it. So we've got the foot here really nicely bandaged up. That's to cushion it so it walks a little bit better. So you can see the pad, got deflection there, so there's no pressure on there, no pressure on here. So we've just got a little tiny one that's probably going to take 1 minute to do. We'll probably tape a little bit more just to secure it in between the toes, so how we do that. But that's what it looks like. So that's treatment is done.